Miss Michaels,
Yes, Sarah.
my patient is on his way back to his room from the post-anesthesia care unit, the PACU. The nurse and I just got the handoff report about his status. Are you able to come with me to assess him?
Oh, sure. Tell me about him.
8 weeks ago, he had a colostomy after a bowel perforation related to diverticulitis. He just had surgery to close the colostomy and perform a reanastomosis of the colon.
Okay. At this point, what do you focus on?
Accurate assessments, monitoring for any complications, and associated interventions, right?
Yes. Ongoing assessments are crucial after surgery. Early identification of postoperative complications is very, very important. And remember, you want to identify if there are any topics that require further patient teaching. So you've received a report from the PACU nurse. And did you review all of the OR and PACU data?
Yes, the floor nurse and I looked at it together.
Great. Okay, let's go assess your patient.
Mr. Lombard?
Hi.
Hi, Mr. Lombard. I'm Sarah. I'm a nursing student. You're back in your room after your surgery. This is my instructor, Miss Michaels. We're going to check your vital signs and do a quick focused assessment. Is that okay?
Yeah, okay.
Okay, good. Going to check your ID band. Is that okay?
Okay.
Okay. Can I get your first and last name, please?
Richard Lombard,
And birth date?
November 11th, 1963.
Thank you. The patient seems drowsy but oriented. Do you agree?
I do. Mr. Lombard, it's okay. The anesthesia's still wearing off, okay?
Yeah.
I'm going to take a quick peek at your dressing first, okay? The dressing is intact. Okay, now I'm going to look at your IV site and check your IV fluid. Okay, the IV site looks good. The IV fluid and the IV rate are correct. Is it okay if I sit you up just a little bit, Mr. Lombard?
Okay.
Okay. Oh, I made you a splinting pillow out of a bathing blanket. Now this, you want to hold against your incision when you move. Okay.
Did you say Sarah?
I did. It's good to see you waking up a bit more, Mr. Lombard. So I am going to go ahead and check your vital signs. I'm going to take your temperature, your pulse, check your respiration rate, and your blood pressure, okay?
Okay.
Okay, all done with your vitals, Mr. Lombard. Your blood pressure is right around your baseline, 122/79.
Tell me, how often do we need to check the patient's vital signs after surgery?
The vital signs need to be checked every 15 minutes for the first hour, every 30 minutes for the next 2 hours, every hour for the next 4 hours, and finally every 4 hours.
Right. That will help us determine if the patient is suffering from complications such as shock or hemorrhage. What's next?
Mr. Lombard's oxygen saturation level is 94% on room air. When we're done with the assessment, Mr. Lombard, I'm going to review with you how to use your incentive spirometer.
Good, Sarah. The incentive spirometer will help Mr. Lombard improve his lung expansion, expel any remaining anesthetic gases from his airway, and improve oxygenation.
Oh, I should check his respiratory status. Before I do that, I'm just going to raise the bed a bit more. Okay, I'm going to help you to lean forward just a bit. Make sure to splint with the pillow, okay?
Okay.
I'm going to auscultate or listen to your lungs. Just there is okay.
Okay,
Do you mind if I unsnap your gown?
Go ahead.
You doing okay, Mr. Lombard?
And just a couple deep breaths in and out for me. Good. Okay, great. Now the front. Go ahead and lay back for me. Okay, good. I'm just gonna unsnap the front, okay? And again, a couple breaths for me in and out. Okay. The breath sounds are a little diminished in the lower lobes, but clear.
Okay, why don't you go ahead and listen to his heart while you're there?
Good idea. Okay, I'm also going to do a quick focused abdominal assessment, okay? I just need to take your pillow for a moment and then lay the head of the bed down just a bit. Okay. Is that okay for you?
Yes.
Okay, good. Okay, excuse me. Bowel sounds are hypoactive, which is normal after surgery. Okay. His abdomen is soft, non-distended. I know your incision hurts, Mr. Lombard, but are you having any pain deep in your gut?
Just by the incision, nowhere else.
That's good. Now, what do we tackle next?
Now I'll check the dressing. Okay, the dressing looks good. I'm checking for odor, any color, drainage. Now there's no odors, but there is a small amount of drainage on the dressing.
Okay, so what should you do?
Well, if drainage is present, mark it by circling the amount on the dressing and note the time. I'll include this information when I document the procedure.
Right. Now remember, if Mr. Lombard had any drains, you would look to make sure that they are patent, that the dressings are secure, and you would describe the drainage.
Right, he doesn't have any drains. There we go. But he does have a catheter. So I will check that. I'm just going to lower your gown, okay? Okay. The urine is yellow to dark yellow and clear.
Okay, now make sure you turn the patient slightly to assess for any signs and symptoms of hemorrhage or bleeding from the surgical site.
Mr. Lombard, I'm going to need to turn you slightly from side to side to check for any drainage. I'm going to lower the head of the bed just a bit and raise you a little bit more. Is that okay for you? Okay. I'm going to get your pillow. Now make sure to splint against your incision, just like so. Okay, now you're going to turn slightly towards Miss Michael, just like that. That's fine. Okay, we're good on this side.
Okay.
And then towards me, please.
There you go.
Okay, thank you. No signs or symptoms of hemorrhage.
I'm really cold. Can I get another blanket? My
Yes.
feet are freezing.
Of course, I have another blanket right here. There we go. Okay, I'm going to go ahead and assess your feet now. I'm I'm just going to move the blanket and sheet up a bit. Go. Okay. Your feet are cool, but your pulses are 2+ and equal bilaterally. The color is within normal limits. Capillary refill is brisk, and yeah, I don't see any edema.
Okay, good job. Okay, now the operating room is cold, so you'll want to make sure a patient is warm to provide comfort and also to prevent complications. And now sometimes in a case like this, an extra blanket can be provided for additional warmth. If interventions are needed to raise the full body temperature, we could use warmed blankets or forced air warming devices.
There you go, Mr. Lombard. How's that?
Much better.
Good.
You look uncomfortable. Would you like your head raised up a bit?
Yes, please. Thank you.
Okay. Tell me when.
That's good.
Good?
Thank
Okay.
you.
Sure.
Okay, Mr. Lombard. On a scale from 0 to 10, what would be your pain?
About a 3.
A 3. Well, based on the fact that you just had surgery and I just had you move around, what would be your pain goal? Is a 3 reasonable? You know, it may not be realistic to expect your pain to be a 0 just after surgery.
Yeah, 3 is actually a number I'm kind of comfortable with.
Okay. If your pain rises above a 3, please let us know right away so we can consider getting you some pain medication. Any nausea or vomiting?
No, not at all.
Good. Okay. Now we're just about done, but before we leave, I wanted to review using your incentive spirometer with you.
Okay.
I'm going to lift the head of the bed just a tad so it's a little easier for you to breathe.
Okay.
If you wouldn't mind demonstrating. Yes. Very good, Mr. Lombard. Just like that. Now, you'll want to be sure to do this about 10 times an hour. Is there anything else that I can do for you before we get ready to go?
No, thank you so much.
You're comfortable?
Yeah, thanks.
Okay. The call bell is just here. Don't hesitate to give us a ring if you need us. We'll be back in 15 minutes from when we checked your vital signs.
Okay.
Okay. Thank you, Mr. Lombard.
Thank you.